In 2010, there were over 34.4 million patients discharged from hospitals in America. The average length of hospital stays for these patients was 4.8 days, or about 4 nights per patient spent in the hospital.
Anyone who has ever had to spend a night in the hospital knows that peaceful sleep is almost impossible to obtain. Illness symptoms can interfere with sleep, as can noisy roommates. The constant hustle and bustle of activity, as well as hospital protocol, often lead to further sleep disturbances due to hospital personnel waking patients in the middle of the night to check vital signs at designated intervals.
Studies have shown that failure to sleep in a hospital slows the recovery of patients with moderate to acute illness, and that there's a direct correlation between lack of REM cycles and wound healing, resulting in extended hospital stays. Patients need sleep for physical health, emotional well-being, and to maintain a strong immune system. It all started last year with a restless post-operative night at a hospital. This night inspired us to create a device that would allow a hospitalized patient not only a peaceful night's sleep, but at the same time eliminate the need for nightly disturbances of nurses checking patients' vitals.
What we have developed is a medical device in the form of a headband that actively cancels exterior sounds and collects a patient's vital signs to be wirelessly transmitted to the central nursing station, all while the patient is sleeping. Across each earpiece is a special pad made of both a soft, sound-insulating material and a small noise-canceling circuit which actively cancels exterior sounds. This will allow a hospital patient to get a better night's sleep in what is traditionally a noisy and disruptive environment.
The key part of this idea is that this headband has no hard components, no pieces of plastic jutting into your head or ears. It's comfortable to wear while sleeping and removes ambient sound without having anything physically inserted into the wearer's ears. Now, in addition to canceling sound, the device also monitors a patient's primary vital signs, such as blood oxygen levels, pulse, and temperature, all throughout the night using a pulse oximeter located across the temporal artery on the forehead, and a digital thermometer located slightly behind the ear. All vital readings from the headband are displayed both next to the patient and down the hall at the central nursing station.
With the headband in place, a nurse no longer has to wake the patient up every few hours to check vital signs throughout the night. This allows for deeper sleep with increased REM cycles, letting the patient recover faster and leave the hospital sooner.
Our business model will be the developing, manufacturing, and selling of our product to individual hospitals and medical equipment distributors.
Currently, we've completed a business model, obtained an LLC, created several working prototypes, and obtained the proper IP protection. Our 14 months of extensive research in academia, informational interviews, hospital visits, and prototyping have allowed us to conclude that this device is feasible, scalable, and can become a beneficial tool for patient advocacy.